tumors go invisible to the immune system because they are most of the time recognized as self. And that's why we always think about cancer as a disease that arises because of the inability of the immune system to see and recognize cancer cells as non-self. What immunotherapies do is they prevent that break from happening, and so these unleashes the immune capacity to attack cancer cells. Immunotherapy has revolutionized the way that we treat cancer. However, there are some tumors that for some reasons that we don't fully understand are very resistant to immunotherapies. One of them is pancreatic cancer, and that's one of the focuses of my lab. Our lab studies RNA splicing in pancreatic tumors to understand how these tumors grow, how these tumors arise, and how these tumors are resistant to any current therapy that is out there. We really want to change the perspective of pancreatic cancer being almost a death sentence to patients. We need to come up with biomarker-based informed therapies because not every patient is the same, and we need to come up with therapies that will boost the immune system to recognize these tumors. We need also therapies that will disrupt the pathways that they depend on that are unconventional from other cancer types. In order to understand very deeply how cells are processing their RNA and how they are producing different proteins, we need to sequence the RNA and the proteins at levels that go beyond of what usually is used in research. We go 80 to 100 times deeper. And that allows us to resolve more transcripts and allows us to resolve more changes of potential protein diversity in these tumors. We also use that platform to derive biomarkers that will help us to understand this tumor is relying on this protein, and because it's relying on that protein, and once we know that protein is important for the tumor to form, then we can say, let's explore therapies that we can assign to tumors that produce that protein X that we're working on. We not only work on translational and basic science, but we collaborate with oncologists, surgical oncologists, pathologists to make sure we're at the translational and preclinical stage, that we are responding to the clinical needs that they have. And so we can go back to the bench and bring new therapies into the clinical perspective. 2 years ago, my own mother was diagnosed with pancreatic cancer. And unfortunately, she passed from this disease. It really made me think that my research matters and that hopefully one day other patients and other families will not have to go and experience this very painful journey for pancreatic patients that currently we have.